We are in conversation with Mr. Dinesh Gundurao, 6 times MLA and our new health minister. Sir, your thoughts on first day at Arogya Sauda and your thoughts as health minister.
This is my second day actually. Yesterday we had done a review meeting with all our senior officers and overall the entire department. And today we are looking at some specific issues, immediate issues. So it's a very, I'm very happy with that our chief minister has given me this portfolio. And so it's a portfolio. The health is something which connects to the entire population of Karnataka, and it is something that is with the people all the time. So a lot of people interface is there, public interface is there. So it's a challenging task for me, and lots of work is there to be done, a lot of decisions to be made, a lot of improvements to take place, a lot of scope for improvement. So I'm looking forward to giving my best.
Okay, any top priorities or goals that you think that immediately I need to address to these?
See, top priorities are there are some many issues which have been undiscussed for a long time. The way 108 ambulances has been functioning, so it's almost becoming dysfunctional. That's a problem. Then our 104 that call center where we have to give readdressal to people calling for advice and immediate medical treatment. That then we need to improve the our way that our hospitals are functioning, make it more people friendly, and see that efficiency improves. So there are many things. There's so many things which are at the top priority right now. Like the Suchi scheme is there, where we have to give all our girls the sanitary pads. That has not been implemented. So all these things we need to do it on a quick footing, get it moving, and at the same time overall the whole department also.
Okay. So when you were in the opposition, there were a lot of allegations made, over the government's the way the health department itself and the health ministry itself was functioning. So are there some of the flaws which you have identified that you need to actually?
See, I have asked them to submit me a few reports. One is what happened during the COVID period, when a lot of purchases were made and a lot of procurement was done. So that entire 2-year period, 2.5 year period, is something we are looking at. I've asked them to submit me the whole details of that. So the department will give me that. Then also we're looking at the last 6 months, how the things have been tendered and what all work has been tendered. So that also Chief Minister himself has asked for the entire report on that. So we're looking at both the angles, both aspects, and once I go through all those things, only then I can make further comments. But we are looking at it very seriously.
Okay, so when you're saying COVID, the first thing that comes to everybody's mind is the Chamarajanagar oxygen-related death. So has there been any? Because we have not even seen the reports. So
yeah. See, what has happened is, unfortunately, the passing of buck has taken place on doing the inquiry. After the judge ordered and found few people liable, then the government had to order an inquiry. But I think this juggling between the health department and the medical education department, that has happened on who has to conduct the inquiry. So they have just passed the buck around. So we have to take a decision on that. And I have also told our officers to put up a note and see that the inquiry should be conducted. And whichever is the department, let us take a decision on that. Let the government take a decision on that. Who has to conduct the inquiry, and take action on those people who are culpable.
Okay. So there is this biggest question everybody has on their mind is, will Namma clinics be continued?
No, I mean, every initiative, government is always in continue. Whatever is good that has been done in the past or by the previous government, we will definitely continue it. So, and we will look at how those Namma clinics are functioning, and if there is any lacuna is there, we'll try and sort out the issue. So, definitely it's something that we are not looking at discontinuing at this moment of time.
So when we look at there has been a lot of emergence of these kind of new infrastructural things have been there. Like there's a new building coming up, there's a new hospital coming up. So that has been there. In the meantime, there's also this huge lot of discussion around public-private partnership of district hospitals, so which has gained a lot of opposition from several activists and health activists and also even public. What is your take on PPP model, the giving the district?
I don't think we should be giving more hospitals on PPP model. because ultimately it's our premises, our doctors, our nurses, our staff. So it's something which I would not want to encourage. That is my initial reaction. I would say that we should desist from giving it out on PPP model. We should strengthen our own department. We should strengthen and make our people more accountable, and we should not give up our own the powers that we have. So I'm not in favor of PPP model, especially in running government hospitals and primary health centers and district hospitals. I think it should be within the government ambit, and that is my assessment right now.
Okay, so when you look at when we are saying that we are not giving it out to the others, then that means that we need to fill in the vacancies which is existing in a huge way. I think there are a lot of vacancies in many of the departments now, so including the drugs. So how do you tend to manage it? So is there any way to immediately?
No, we have also committed that we are going to fill in the vacancies over the next few years. We want to fill up all the vacancies. Not only in my department, across all departments. That's a commitment in our manifesto also. So we will start looking at how to, there are a lot of vacancies in certain parts. So we will start looking at that and in a phased manner try and fill up all the vacancies, because we need those people. We need technicians, we need attenders, we need ground staff, and all that is a big requirement. Like you said earlier, we can build the infrastructure, but if you don't have maintenance and people to man it and run it, then all that equipment and infrastructure will be underutilized, sometimes not utilized also.
So lakhs of kidney patients especially are suffering because of the dialysis centers cancer. I mean, there has been a huge, even South First has reported about it on how the technicians are just doing the dialysis and the equipments are bad, and the new tender is just going on being postponed, that it's been called. So any efforts?
That's the priority again. Like you said earlier, what are my priorities? That's another priority for us, to get these dialysis centers running, and also to finalize the tender, make it transparent and ensure that the right rate is arrived at. And that is something we've also discussed today. And these are all decisions that we have to make in this next 1 month. Okay. We don't want to delay this process. 108, 104, dialysis, Suchi, all have been lying in limbo for a long time now. And so that is also a priority for me, to see that we get all these dialysis centers up and running, and see that we finalize the tenders and do it in a transparent manner.
So Rajasthan has right to health bill. So do you think Karnataka should have one?
Yeah, but I think, Karnataka has also had we've passed acts before when Mr. Ramesh Kumar was the the health minister. Also, we have tried to bring in reforms, and then now, though we have universal coverage where we give up to 5 lakhs for all the families, and for APL families we give up to 1.5 lakhs. But still, I think there is some lacuna in that system. And right to health is something that I think even Rajasthan government did come out with an act. Then also they had to face a lot of dissidents from the doctor community, the medical community. So they had to water down the act again. So we will also look at it and see how we can ensure that every person in the state will have access to good health care. That's ultimately the intention of a right to health, that everyone is able to access an affordable access. So how do we do that? That is something we have to look at.
So you are open to something?
Yeah, it is. That's what right to health ultimately comes down to, that every individual should be able to have access to good health care and affordable health care.
So when we're talking about affordable healthcare, there is a lot of lacuna in terms of availability of medicines. There is Tamil Nadu has an excellent model of where they can avail medicines very easily. So what kind of?
Yeah, that also we've discussed, and some medical supplies and tenders for that have not been able to. They've not been able to finalize, and there's some problem going on with that. So we are also, that's also another priority. These are the immediate things that we have to decide. The lot of medicines are not in supply in hospitals right now, and there is no supply happening because of certain issues with the procurement. So we have to ensure that this procurement process is streamlined and see that there is no delay in the procurement. So that is something we are looking at now.
Okay.
Yeah.
So this is one question. How different is Mr. Dinesh Gundurao going to be as health minister? I mean, from the past we have seen several health ministers come by. So how different?
I don't want to compare myself to the. There have been very many good health ministers, and there have been some more average health ministers. No, I don't want to name them, but ultimately, I will want to bring in, I will give my best to this department, and to see that we bring in reforms, we improve our capacity, and we streamline the way the department functions, and bring in changes in policy. So, since we have a good mandate, we have a stable government, we have a very good chief minister. So I think there's so much to be done, and I'm really quite excited doing all these things. And it's good for me also as a political leader, public leader, because if I can perform well in this, it also helps in building my own public image. And people, I want to earn a good name and see that during my tenure, the health department saw some good, a lot of good changes, and the systems have been improved. So that is because we are not going to be here permanently. We are here maybe for how long we are here. So for whatever that duration is, I will give it my all.
So 40% commission is what, I mean, the previous health minister was the most, the people's mandate, of course, has shown it, but then there has been allegations against him for being the most corrupt minister and all such things. So how do you tend to deal with this corruption charges?
Correct. So we will look at all those things, whatever has been done in the past. Like you said, lots of allegations were there, which we only have made, and it was even public knowledge. The people also were talking about it, not just us. And it is something that is it's very unfortunate, because this is a department which serves the people, and especially the poor people. So if that is not being if there is siphoning of funds which are meant for the poor, then it affects the poor people a lot. So I think that is something which we have to combat. And I will also do my best to see that the corruption is reduced. We minimize it. See that the leakages become less, and transparency is more. So we are working towards that.
Okay, one last question. So despite Chief Minister Siddaramaiah promising that all the 5 guarantees which has been announced will be given, there is a lot of instigation coming from the party saying that do not pay your electricity bill, or do not take your bus pass and things like that. So how anything on that?
See, that already we have said this is one guarantee that we can give is that these 5 guarantee schemes will be implemented. Now, the process of implementation is always a challenge, and that is something that we are going to be doing. And so I would not want to make any further comment except the fact that the day after we have a cabinet meeting, and today we had a presentation regarding all the 5 guarantee schemes by the government, by all the officers, and the pros and cons of everything has been shown to us. We've discussed it. So in the cabinet, the day after, I think many of the decisions will be taken.
So does it look good that all the...
No, it is something that we have to do. We are committed to the people of the state, and we will do it.
Okay.
Yeah.
Thank you very much. It was wonderful having you here.
Thank you.
That is all we have for today. Thank you.